Earl, and today we're going to be talking about manual restraints. So manual restraints have varying levels of severity depending on what you're doing. They could be simple as a halter and lead rope just to lead your horse around, or even go as far as a chemical restraint to help during clipping or other irritative procedures. So we're going to start with our halter and lead rope. Your halter should fit on your horse's face pretty well. You want a really good fit on your horse's face. So in dressage, we prefer the halter nose band to come about 2/3 of the way between the nose and the eyes, about 2/3 of the way down. That way that it's not on the cartilage of the nose that could be damaged. So some other disciplines, such as Western, prefer your halter to be a bit smaller or tighter fitting, and they prefer for the nose band to sit about halfway between the nose and the eyes. So then I also have this lead rope here that I'm going to use just to lead Earl around, just to give me a little bit more leverage, but as he's a pretty well-behaved horse, we don't really need a whole lot of leverage. If I found that the lead rope was not enough, then the next step up would be go to a chain shank. So I'm going to have my handler here come over and grab Earl. This is Abby, very wonderful handler. And I'm going to demonstrate the chain shank. So when you have a handler, it's really important that they stay on the same side of the horse as you so that they can see what you're doing and be prepared for any movements they're going to make, or the horse might make, especially if the horse decides to shy to one side. You would rather it be away from the both of you instead of run one or the other over. So I have my chain here, and this is your next level up of severity from your halter and lead rope. So what I'm going to do is I'm going to come over here to the lower ring on the near side, and run in and pull it down, and I go over and step on the other side, and then I run up through the lower ring and connect to the upper ring. And you want to make sure that your thumb tab is facing outwards because it can gouge the horse's face. So now you have a little bit more severity on your lead rope if you need it, and you can yank down on it if they're misbehaving, and it just gives you a little bit more leverage than having just a regular halter and lead rope. And it's really important that you keep a hold of both ends of the rope on the clip and the end of the rope while you're attaching it, so that way you don't fling the clip around and hit them in the face, and also that they don't step on the rope or something and then spook themselves. So then to take it off, it's the same thing but backwards. You go back around the upper ring and you unclip it, run it back through, keep a hold of the clip, come back around, and come back through the lower near side ring. There we go. You should never tie a horse while you have the lead chain on, because if they decide to pull back for some reason, they're going to spook themselves and could actually end up hurting themselves and breaking the cartilage or nose. Okay, so next we have the gum chain. The gum chain is the next level up of severity from the chain shank. So it's applied kind of in a similar manner to the chain shank. We're going to come around and go in on the lower side ring, keep a hold of your clip and the end of your rope, and then we're going to go over to the other side and go in or out from on the lower side ring and clip it to the upper ring with the thumb tab facing out. So then I'm going to come back around over here, and I'm going to take the links, and you want to make sure that your links are laying flat and that there's no jagged edges on it, because the gums are really sensitive, and if it's not flat or you have jagged edges, it can really hurt their gums. So I'm just going to come over here and gently lift up his lip, and then pull the gum chain down gently. So you got to keep some downward pressure on the gum chain in order to make sure that it stays in place. And you don't ever want to pull up on your gum chain either, because it's a lot harder to maintain that leverage if he decides to swing his head or something. So then to remove it, I'm just going to reach up here underneath his lip and then release the chain. There we go. And then come back around and take the clip off and then run it back through. And make sure you keep it attached, keep a hold of the clip so it doesn't swing around and hit him in the face. So next we have clip twine, which is just slightly more severe than your gum chain, just because it's a thinner material, so then it puts more pressure on the gums. It's also much easier sometimes than having a chain because it doesn't make a noise, it doesn't clink like the chain does, and you usually have a lot of twine on hand, so you can just grab it and carry it with you in case you need it. So we have ours here is tied in a loop to make it just really easy to use and quickly. So it's pretty similar to the gum chain. I'm going to come over to the outside, and I'm just going to attach it to the lower ring by running it through the loop that we have. There we go. And then I come back around, and we're going to again just lift up the upper lip and lay it on the gums. There we go. And I'm going to again keep some downward pressure in order to make sure that I keep pressure on the gums and that it doesn't slide off. So then to release it, I'm just going to kind of pull it out of his mouth. There we go. And then pull it out of that lower ring and unloop it on this side. There we go. So then, if you've used one of those for such as like clipping or any vet procedure that needs to be done, and those were not effective enough, then your next step up would be your twitch. So your twitch is really important to be really careful about. So when you first apply this twitch, there's kind of like an irritative stage where they are just kind of shocked by it. So for about 3 to 5 minutes, that they're just kind of like shocked by it, it doesn't really do anything. And then after 5 minutes to about 10 minutes, you get kind of in a stage where they release endorphins and they'll kind of calm down a little bit. Usually you'll see their head lower slightly. After about 10 minutes though, you hit the blow stage where it stops releasing those endorphins and it becomes painful. And it's really painful, especially because it can cut off circulation to the muzzle. So you want to be really sure that you don't have this on that long. So another important thing is to make sure that you keep a good grip on your twitch while you're using it. You never ever want to let go of your twitch while it's on a horse, because then they can swing it around and hit people with it. So what you're going to do is you're going to make sure that you put your fingers through your twitch and that you have at least one finger out of your twitch. So that way you can be able to get out quickly. So then I'm going to come over here. I'm going to grab the muscular part of his muzzle and slip the rope on. Boom. And then I'm going to twist it into place. And I can tuck it under my arm to keep it in place while I'm still twisting. So there it's in place, and you've got to hold it really well. You can kind of hold it at the end of the stick to make sure that you have more leverage and can kind of stand a little bit further back. And when you're done, you just untwist it and they'll slide right off. Good job, Earl. Good job. Another one we should mention is an ear twitch. This, where you grab the ear and kind of twist it a little bit, and that will surprise them a little bit. But we actually never use this at William Woods. A, because it can make them really head shy, and horses tend to be head shy already. And B, because you can actually damage the cartilage in the ear. So, yeah. Okay. So next I'm going to demonstrate a shoulder roll. And a shoulder roll is a good restraint that you can use really quickly. You don't need any supplies for it. That'll just kind of incapacitate them for a few moments. But you can't really hold it very long just because your hand will get tired quickly. So you're going to come over to where the spot where you give an intramuscular shot or injection in between the spine, the nuchal ligament, and the scapula. So about right here is where we're going to grab a pinch of skin and we're going to roll it over. And you'll see most horses will bow away when you do it. And this will distract them really well. It's really good for quick procedures such as giving like a joint injection. So I'm going to come over to Earl, and I'm going to grab some skin, and I'm just going to twist it under. There we go. And then I'm done. I'm just going to kind of smooth it out. Good job, Earl. And you did see that he did bow away a little bit. And you want to make sure that your fingernails are really short whenever you have to do a shoulder roll, because your fingernails, you don't want to dig into the horse. So then we have a leg lift. A leg lift is a good thing to use when you are working on one particular limb and you need that limb to stay still. So horses generally cannot lift lateral pairs. But we will always lift just the front limb. We will never try to lift a hind limb because it's more powerful. So if we're working on a hind limb, you're going to lift that front limb on the same side. Whereas if we're working on a front limb, you're going to lift the front limb on the opposite side. So we're never going to try to lift a hind limb. So, and the way you do that is you come over and you pick up their foot just like you would normally to pick them out. And then you're going to grab them by the plastern and fetlock and kind of want to stand braced and just hold their limb up. And you should be able to hold this for a decent amount of time. And then you can just put their foot back down when you finish working on what you were working on. If one of these is enough, or for longer procedures such as like clipping, body clipping, or sometimes for sheath cleaning, and this isn't enough restraint in order to keep all your handlers safe, then your next option is to move to chemical restraints. So we have ace-promazine, also known as ACE, and xylazine, that is also known as rompin. And you will give 1 to 4 cc's of these drugs either intramuscularly or intravenously. We also have ditomidine, also known as dormocidin, and you will give 1/4 to 1/2 cc of this intramuscularly or intravenously. Another restraint that you can use is also your voice. So your horse can be really responsive to either calming voices, such as like shushing or like talking quietly. Those would be really helpful to help calm a horse down. Sometimes it works, and then sometimes it's not enough, and you need to move on to another kind of restraint. Or if you have a horse that's acting up and being naughty in some way, then you can also use aggressive verbal restraints, such as kind of shouting or growling or other quick, loud things to get their attention. But there does come a point where this is not very effective. Cussing at your horse will never be effective. They don't understand what that means. Okay, so those are your restraints. So those are your restraints. Each one has a few different uses as we've gone over, and you always want to start with the lowest restraint possible. You don't want to use a higher severity restraint if you don't have to. So try to keep everything as gentle on your horse's